What types of marks are left by different strangulation methods? Have you ever wondered how forensic experts can tell the difference between various strangulation methods just by looking at the marks left on a victim's neck? Understanding these marks is essential in true crime investigations. Let's break down the types of marks that different strangulation methods leave behind. First, we have manual strangulation. This method involves applying pressure directly with hands, arms, or legs. The marks typically include bruising and abrasions from fingers or thumbs. You might see specific lesions, like bruises at the base of the thumb, which are characteristic of this type. If the victim struggled, there could be fingernail scratches or imprint marks. Internally, there can be serious injuries like fractures of the hyoid bone or thyroid cartilage. The bruising from manual strangulation is usually irregular and located, where the hands gripped the neck, often accompanied by swelling. Next up is ligature strangulation. This occurs when a ligature, such as a rope, wire, or belt, is tightened around the neck. The strangulation mark appears as a distinct, often horizontal pressure groove on the skin. Initially, this mark is pale but can turn yellowish-brown and parchment-like as it dries. The shape and width of the mark correspond to the ligature used. And like hanging, ligature marks are usually horizontal and encircle the neck at a consistent level. If the victim was dragged during strangulation, the mark may appear oblique. Beneath the ligature mark, you may find bruising and hemorrhage in the underlying tissue. These marks are well defined and can help forensic experts differentiate between types of strangulation. Finally, we have hanging. In this method, the body is suspended by a ligature around the neck, with pressure caused by the weight of the body. The ligature mark is typically oblique, running diagonally across the neck, and is often higher than in ligature strangulation. Sometimes, the mark may be incomplete or discontinuous due to the position of the noose. Initially, the pressure mark may be pale but becomes more prominent over time. Similar to other strangulation methods, hanging can also cause fractures of neck structures. The pattern and angle of the mark help forensic experts distinguish hanging from ligature strangulation. Understanding these different types of strangulation marks is vital in forensic investigations. They help forensic pathologists reconstruct the events leading to death and determine the mechanism of strangulation. The presence, shape, and location of these marks can indicate whether the victim was alive during the event and help differentiate between homicide, suicide, or accidental asphyxia. Detailed documentation and photographic evidence of these marks are essential for legal proceedings. Forensic nurses and investigators often use specialized light sources to detect bruises or marks that are not visible to the naked, especially in survivors of non-fatal strangulation. By knowing the types of marks left by different strangulation methods, we can better understand the circumstances surrounding a death and support criminal investigations.